clearly the approval last night of the release of the first 4 batches of the locally produced AstraZeneca vaccine is another major step in tackling COVID-19 in Australia. 4 batches totalling 832,200 doses of the vaccine have now been approved, as the Minister has said, for supply right across the country. And of course, this follows the approval on Sunday of the manufacturing process by CSL and the earlier approval for the overseas manufactured doses of the AstraZeneca vaccine. The TGA process, looking at the batch approval, ensures that locally manufactured vaccine has exactly the same composition and performance as the overseas manufactured vaccine, the exact same quality, and of course is free of any contaminants. And what will happen over coming months, each batch that CSL produces in Australia will go through exactly the same batch testing to ensure the quality of the vaccine before it's released for use across the country. So as the Minister has said, this vaccine will now be rolling out to general practices, general practice respiratory clinics, and to Aboriginal health services right across Australia, boosting the number of vaccines that we have available each week. This morning, I had the privilege of attending the Woonunga Namitja Aboriginal Health Service in Ngunnawal country here in Canberra, where local Ngunnawal elders received their very first dose of the AstraZeneca vaccine, along with Minister Ken Wyatt, the Honourable Linda Burney, and also Professor Tom Calmer. So they received their first dose today, they'll receive their second dose in 12 weeks. And just a reminder that as well as rolling out this week the vaccine for those aged 70 and above, Aboriginal and Torres Strait Islander people aged 55 years and above are eligible to receive the vaccine this week. A number of Aboriginal medical services have started delivering doses this week, and that number will rise over the coming weeks as well. Thank you, Minister.
Great, happy to take...
Welcome. Minister, you say that you're accelerating the rollout, but you're still well behind what you'd hoped. Do you think you'll be able to catch up on some of those numbers that you'd hoped by the end of March?
We're making progress, and there's no question what we've seen is last week was 116,000. During 1A we were hoping at 80,000. Let's go back, and I think it is important to put the history in context. January the 7th, once we had the affirmation from AstraZeneca that they'd provide 3.8 million before the end of February, that was when we made that, once it was absolutely confirmed. January the 25th was when we revised that, and many people have airbrushed that moment from history. I was here. January the 25th was when we did that, and some have airbrushed that exact moment. And why did that change? Because, as we know, there was a massive global supply chain challenge for AstraZeneca. In the end, we've received 700,000, and we're working on the other 3.1 million, but we're not banking on any of that other. So the decision to create the sovereign domestic manufacturing capability, which was hard fought and hard won